Did you know you can take advantage of our elite membership for free for 14 days? This provides you access to our instructional videos, live and on-demand webinar library, and certificate programs. Give it a try and see what you think. And if you love it, don't forget at the end of your free trial to sign up and take advantage of VetGirl's Veterinary Technician 30% discount. Hi, Vet Girl. In this podcast episode, we are interviewing Darcy Palmer, LVT, VTS, and Anesthesia and Analgesia, the AVTAA Executive Secretary, and past president of the AVTAA, Jody Nugent-Deal, RVT, VTS, and Anesthesia Analgesia, and Clinical Practice Exotics. Thank you, ladies, for joining Vet Girl for this interview about the road to becoming a VTS in Anesthesia and Analgesia.
Thanks for having us.
Yes, thank you.
I'm excited to chat with you ladies. Obviously, I love being a member of this academy as well, alongside and being able to serve with you guys in a variety of capacities through that. Let's start out perhaps with just giving our audience a little bit more information about what the Academy of Veterinary Technicians in Anesthesia and Analgesia is and who we are made up of.
Sure. So we are the second approved VTS. There are multiple VTSs that we have nowadays, but we were first approved in 1999. The first VTS was emergency and critical care, and then the AVTAA came second. We are made up of a vast group of technicians that work with small animals, large animals, exotic animals. We encompass many facets of veterinary medicine. So you may find a VTS in anesthesia and analgesia in a surgical referral practice. You may find us in a veterinary medical teaching hospital or in other academic institutions. You may find us in a research facility or any sort of clinical hospital practice. So I think we have about 275 members, give or take, currently. And I think that is a really impressive number for the makeup of our academy.
Outstanding. So, as the AVTAA, how do we stand apart from other VTS academies, perhaps like surgery, clinical practice, rehab? What really makes us stand apart or different?
I would say that for the VTS in anesthesia and analgesia, our requirements are such that we really focus on advanced anesthetic cases, those more critical cases where you're looking at like an ASA 3 status or above. And so all of our goals are to ensure that our members are trained, are competent and comfortable with those advanced critical management of anesthetic cases. And this differs from other VTSs because a VTS in surgery is really exactly what it says, right? So they're focusing on the surgical component of that procedure where we're focusing on that peri-anesthetic period. In clinical practice, for example, many people are doing anesthesia in clinical practice, but they may not be doing it at the level that we would expect from a VTS in anesthesia. They may have those tough cases, but they're not doing it a majority of their time. And we differ from rehab because in the VTS for rehab, they're looking at not only acute pain, but also chronic pain. They're using other modalities that we wouldn't necessarily need to utilize during the peri-anesthetic period. And so you would see a vast difference between us and all of those different academies.
And feel free, Darcy, to jump in if you have anything to add. I will say I'm biased. I do think we're the best academy, but I also have a VTS in anesthesia and analgesia. So
Yeah,
again,
I would agree
bias.
with you. Sorry, Jody.
Oh, that's okay. I love both of my academies, so we're good.
Yes. And you guys both represent your academies extremely well. Obviously, you do represent the AVTAA very well as well, being past president, immediate past president at the time of this recording, and the current secretary. Now, Darcy, tell me, you've been the executive secretary for a couple years now, yeah? 8, maybe?
Yes, since 2016, because that is when I came off of my 6 years of being president-elect president and past president. And then that's when Sharon decided to retire. So I took over the executive secretary at that time.
Well, that's a wonderful position for this next question. Can you give me a rundown of the timeline or process, perhaps from a start to finish, of what it would look like for someone to become credentialed as a veterinary technician specialist in anesthesia and analgesia? And keep in mind that some of our audience may not be a credentialed technician listening. So the broad scope of start to finish for someone to achieve this credentialing process.
Okay, excellent. So yes, so in order to apply to any VTS academy, really, you do have to be a credentialed veterinary technician, and you have to have so many hours as a credentialed veterinary technician. So I say veterinary technician, meaning in the United States, but we are international as well. So we do accept veterinary nurses from other countries like Australia, the UK, New Zealand. So if the title veterinary nurse is recognized in any other country, we do include veterinary nurses collectively under the term credentialed veterinary technician as we're talking. So once you have become credentialed as a veterinary technician or a veterinary nurse, you must have a minimum of 4 years of credentialed experience. And for us, we will accept 2,000 hours per year. So that's equivalent to full-time work, which in the United States is 40 hours per week. And then we times that by 50 weeks a year. So we will accept a maximum of 2,000 hours per year. So you must have 4 years, so equivalent to 8,000 hours of credentialed work experience. Our time frame for looking at that work history operates on a June 1st to June 1st calendar year. So you must meet that requirement by June 1st of whatever year you plan to apply. And then from those 8,000 hours, you need to show that you spend at least 75% of your time, which is equivalent to 6,000 hours, specifically in anesthesia care and case management. Now, this time frame overall, or these hours, we will look at 5 years of work history immediately prior to when you plan to apply. And that 5-year period jumps ahead by 1 year for every year the application is issued out. So you have that 5-year period to show those hour requirements. And so that's requirement one. And then another requirement is that an applicant during their case collection year, they must work with a boarded specialist. So that can either be a DVM that has finished a residency and become boarded in one of the AVMA colleges or boards, or an equivalent for an international specialty organization. And or you could work with a VTS in any of the recognized VTS academies, as long as that individual spends a good amount of time in anesthesia. So for example, if you just work with a VTS in nutrition, that's not going to be a specialist who can properly be your mentor through this process. So it has to be a specialist that spends a great deal amount of their time doing anesthesia, so that they themselves are considered masters of all of the skills and knowledge base that is required on the AVTAA application as well. So after that, then comes the application process that you're going to put together. And so I'm just going to use an example since we're going to talk about this next year. So let's say in January 1st, 2025, the AVTA application will be the 2026 AVTA-AA application packet. And why we do that is that the application year actually corresponds to the year that you would be sitting for the exam with a successful application. So it takes the entire year to put together the application, and then you find out if you're eligible to take the exam that following March. And that is why the application year corresponds to the exam year. So if we're talking about the application that will be completed in 2025, again, that will be the 2026 AVTAA application packet. And so that packet will be available no later than February 28th, 2005. You will be able to start case collection for this application as of January 1st, 2025. And you can technically collect cases all the way up until December 31st, 2025. The pre-application is due no later than June 1st of 2025. And then the complete application is due no later than December 31st, 2025. The results for that application are going to go out no later than March 31st of 2026. And then if your application was accepted, you will be sitting for the examination in September of 2026. You do have 3 attempts to pass the exam. And once you have passed the exam, you gain the credentials VTS and then in parentheses, anesthesia and analgesia after your name.
Ooh, I hope you had all of those dates written down. I don't know how you keep it straight. Um, but yeah, as we can see, the process is quite long, not just to get qualified to start the process, but the process of actually then preparing a packet and sitting for the exam in itself is over a year. So it's a very impressive
Yes.
process. Obviously, there's case reports and case logs and skills lists. Yeah. Wow.
Yes, yeah, it is an intense process, but the whole point of a VTS is to kind of push you to the next level. So, if you're sitting around and you're a credentialed veterinary technician, and you're like, dang, I'm kind of bored, looking into a VTS is an option to consider because this process is designed to help you gain and improve your knowledge and skill level. So that's really what a VTS is taking your knowledge and skill to the next level.
Yeah, and perhaps it's worth mentioning that each VTS academy has their own credentialing process, could vary from academy to academy. So it's really important that any listener interested in pursuing a VTS checks out that specific academy's requirements. So that was a lot for our audience to take in. It was a lot for me to take in, and I've been through the process. Albeit it was long ago in the sense that it looked a little different back then. But
Yes.
as things evolve, things could change, which again is why it's so important that you check in with the academy approaching the time that you're interested in pursuing that process. Tell me, how does one really set themselves up for success in pursuit of that VTS, specifically in anesthesia and analgesia?
So I think that this is really where the type of practice and the cases that you are exposed to on a regular basis are really going to make or break your ability to be eligible to apply to AVTAA. So one of the things our academy, like Jody's mentioned, is that we are looking for applicants that have continuous exposure to cases that qualify as ASA 3 and above. So these are the advanced level cases where they are presenting with some kind of systemic disease or condition that has put them at an increased risk for anesthesia. So whatever that procedure might be, those patients are already presenting with comorbidities that alter and change the way that we manage them during the anesthetic event. So in order to be successful on this application, you really have to be in a situation or in a clinical practice that gives you that exposure to those kinds of cases. And with that, if you talk to anybody in AVTAA, drug protocols are not based on clinical routine. They are very much based on how that patient presents. And so if you're going to be exposed to a lot of different cases, you have to have a lot of different drugs so that you can put together an anesthetic drug protocol that best fits that patient's individual needs rather than just using a set protocol that you use on all patients, which might be something that is more appropriate if you're dealing with an otherwise healthy animal. So knowledge of why you use those drugs, when you use those drugs, access to advanced monitoring techniques, things like placing arterial catheters in these more critical compromised patients, use of a ventilator, blood gases, all of those things that you would be doing on these more advanced cases where you might not be doing those types of things on an otherwise healthy animal. So really it's the environment that you are working in that is going to ultimately determine if you're eligible to apply to AVTAA. And it is a requirement right now that during the case collection year, you have to work with that boarded specialist, either a DVM or a VTS. So that is, where you work and who you work with are important to this process.
Now, that's very interesting. I want to ask Jody, I know having a clinical practice VTS with an area of emphasis, they have these like subcategories in clinical practice. Well, anesthesia doesn't necessarily have a subcategory in that we perhaps hyphenate our anesthesia analgesia in a similar fashion to clinical practice. Can you speak to that we do have species kind of variation to our exam, so a large and small, and just perhaps where that area of specialty falls in, that if I'm someone really interested in pursuing a VTS and anesthesia and analgesia, maybe I only work with horses or large animals, how that might look for someone that is fitting that market versus perhaps maybe I'm a technician that's working in majority with exotic creatures, but still sees the occasional dog and cat. Do I have a chance?
Yeah, that's a great question. So when I actually applied for my VTS in anesthesia and analgesia, I was primarily working only in exotics with the occasional dog and cat. And so a majority of my application was exotics based. And you can absolutely qualify for the small animal application by doing primarily exotics, as long as you can meet the other criteria with writing up advanced case reports, writing up appropriate logs, being able to meet the skill set that is required. You can absolutely do primarily exotics. It doesn't have to be just dog or cat, or it can be a mixed bag. But if you are doing companion exotics, that does fall under the small animal application and the small animal examination. If you're doing large animal, then you have a whole separate application. Now, the applications are similar, but they are not exactly the same for obvious reasons, right? The skill set and some of the equipment we use is different with large animals compared to small animals. And so if you are only working with large animal species or only working with horses, for example, then that would definitely put you under that large animal application and the large animal examination. Now, some people may be asking or thinking, like, I only work with dogs and cats. Do I need to know about exotics for my exam? Yes, you potentially do. So we do tell our small animal people that, even if you don't work with rabbits, there could be some rabbit questions on the examination. If you work with large animals, but let's say maybe you only work with primarily horses, you still may need to know about goats and sheep and pigs, because it is an all-encompassing large animal exam, small animal exam.
Nothing causes me more anxiety than having to intubate a rabbit. Although I do follow what the two of you have recommended, and it has worked every time for me. But
Yes.
man, I'm still anxious about it. And I always ask if there's anybody else that has more experience before I have to ever intubate a rabbit. So I'm
Yeah.
thankful for those who have skill sets in other species, definitely.
It's one of my favorite things to do is intubate rabbits. Let me tell you, I
Ugh,
love it.
it's my nemesis species, man.
um,
Um, I will
I
just add on to piggyback on to what Jody said there, because, she was primarily exotics when she did her application. And the big key difference there is the status of the animals coming in. So, if she was doing a spay on a bearded dragon, anesthetizing a bearded dragon for a spay, that might count for 12 of her ASA 1 and 2 cases, but it's not going to count for an ASA 3 and above just because it's a bearded dragon and it's a species that you might not get to work with all that often. But that animal presented otherwise healthy, otherwise it wouldn't be undergoing a spay. But our application is asking for at least 75% of your case logs to qualify as an ASA 3 or above. Same thing with horses. And this is a very common question that I get. Somebody works just in an equine only practice and they want to know if they qualify. And again, it falls back on the types of cases they see, because, other than colics, there's not a lot of disease processes that horses present with that require anesthesia. And so that person is then tasked with ensuring that they have a good caseload of rounded cases of horses that qualify as ASA 3 and above and have need anesthesia for either surgery or some kind of diagnostic procedure. Otherwise, they're not going to have a large enough caseload of advanced cases for the application.
And that's interesting that you brought up that is a common question. Pivoting just a bit, Darcy, as executive secretary, I believe you're the one of our academy that's getting all of those emails, correct?
Yes.
The prospective applicants' emails. And so I'm interested if it would be of interest to our audience, perhaps, that you share with us just some common questions that the organization gets asked and perhaps how to navigate those questions so that maybe a few less emails in the future to respond to.
Oh, I like answering emails. It's all good. I would say probably the top question that I get from people is just wanting to know if they're eligible to apply. And so a lot of that requires me asking questions about where they work and how long they've been a credentialed veterinary technician or veterinary nurse. And then we look at their, license requirements, making sure that they have met the requirements within the specific time frame that we're looking at for whatever application packet we're dealing with. And then the type of practice that they work in is probably the most important thing that people are curious about. I know a very common question that I get is from people who work in general practice, and they might be anesthetizing patients 60% of their time, but they're otherwise healthy animals. And so that's where the distinction is made between clinical practice and us, is the types of cases they are anesthetizing there. And then I would say that probably the next common question that I get asked a lot is people are wanting to know more information about our course or our training program. And I just want to make the distinction that none of the VTS academies are set up to be training programs or courses that you can take. In order to be eligible to apply to a VTS academy, you already have to have that advanced knowledge and skill level in whatever specialty area you're interested in. But you have to gain that experience by working in an environment that gives you access to that advanced knowledge and skill. And that's a little bit, different from like the veterinarian aspect of it. Is they go into a 3-year residency training program where that's basically their life for 3 years. And that 3 years is preparing them to become a boarded specialist and get them to a point where they are eligible for their board exam. Whereas the VTS academies, we are relying on work experience and working with a specialist to help with our knowledge and skill level. So with that, a lot of the advanced knowledge comes from us doing it our own, self-study, working with a specialist, having those one-on-one conversations with the specialist, talking about involved cases, being involved in case management on the clinic floor. That's how we are gaining our advanced knowledge and skill rather than an actual training program that you go to.
That's interesting. And what about the person that wants to help the individual achieve this? What does it look like to be a mentor for this? I mean, without formalized training programs, even in formalized training programs, people have mentorship, mentors that are assigned to them. What could you give as tidbits of information or knowledge to someone who wants to help someone achieve this credentialing process?
I would say that first and foremost, whoever is being asked to be a mentor and chooses to help mentor a prospective applicant, they must read our application. And please read the current application that's posted on the website, because small changes do happen potentially from year to year. But I would say that that is one of the biggest helps that a mentor could provide, is to understand the specific requirements to help that applicant be successful. If they don't know what the academy expects from our applicants, how are they going to be an appropriate and positive mentor for that person? So I think that's first and foremost. I also think that the person mentoring them needs to be comfortable in the area. They need to be an expert in the area of anesthesia and analgesia. And I think that they also need to ideally set aside time to have meet up with that person, discuss cases, have rounds with that person, maybe have informal training so that they can better prepare them for the application and then the examination process should their application pass. And so I think it's just like that general mentorship that is so important. Like we need to hit all the facets of understanding the academy's needs, preparing the person to be successful, teaching them the skills that they need to master, being able to have discussions about anatomy, physiology, pharmacology. All of those things are going to help that applicant be successful, and that person will be a much better mentor if they can sort of hit those marks.
And maybe worth mentioning the website, just so everybody can find this information, whether they're interested, they're a technician looking to pursue a VTS, or maybe they're the mentor that wants to help someone achieve this credentialing process. Could one of you share the website with us?
Sure, it's avtaa-vts.org.
Yeah, excellent. So avtaa-vts.org. That's a great resource for everyone to get started anyways, even if you're a few years out, right? Good place to start.
Yes, and we do have like some frequently asked questions on there, and then it kind of does a rundown of the process and the requirements for the application.
So let's say I'm a technician. I've gone through the process. I'm a VTS in anesthesia and analgesia now. How do I keep it? What does it take to keep your VTS?
So that's one of the things with all of the VTSs, not just anesthesia, but everybody has to re-credential every 5 years. And so specific to our academy, we require that our members acquire 50 points over that 5-year period. And so the easiest way to acquire those points is to just go to CE that is specifically related to anesthesia. You can also gain points by serving on committees and doing lectures and labs and courses online. And that's really, one of the main benefits to being a VTS is having that network and platform in which if you are interested in speaking or you're interested in writing an article for a magazine or a journal or maybe even a book chapter, that's kind of where the VTS is helping to elevate people to that next level and give them the resources to do those types of things. So if you are an author, if you are a speaker, then those are things that you can also use to accumulate points for your re-credentialing packet. And then another requirement for us is that you have to write so many exam questions. Our exam committee is active and busy all throughout the year. So not only are they reviewing the exam and making questions themselves, but then they take all of the re-credential questions that they get from our members every year and they go through those and vet those and make sure that, references are appropriate and within that 10-year time frame. So that's also a requirement for that. And then, so every 5 years, you are going to re-credential to maintain your VTS title.
Yeah, Jody, anything that you found achieving your VTSs have allowed you to do that perhaps in a former role you weren't given the opportunity to have?
Certainly, there's many opportunities that I think or many doors that have opened because I have my VTS. I would say that maybe this isn't a door that has been opened, but I'll be honest in that I thought I was a fairly decent technician who knew a good amount of things before I went through the process. And going through the process made me realize how much I actually needed to learn and how much I could grow my knowledge base and my skill level. And so, I think that becoming a VTS, regardless of what doors it could open, it's made me a better technician. It's made me more knowledgeable. I have a better skill set, and that equates to better patient care. And so I think that's one of the most important things is that by becoming a VTS, you are going to be a better patient advocate and you're going to be just better at patient care and just do a better job at taking care of those animals. Other things that I think I have benefited from is I certainly have been able to write book chapters, articles. I've been able to lecture nationally for many years. I've been able to maybe even, start this new position that I'm in as a hospital trainer because I have, 2 VTSs. And so I think it just opens up many career opportunities as well.
And hopefully a
Absolutely.
company's pay raises, right? If we get our VTS, hopefully our employers are supportive of that and it helps our pocketbook too, which, it does matter at the end of the day. We all have bills to pay and we're human.
It's true though. It's very marketable, right? Like if you have a smart practice manager in place or a smart person doing business for your practice, it's something that's extremely marketable. And because, you are providing more advanced services and better care, like why wouldn't we want to market it? And why wouldn't we charge potentially more for the larger, more advanced skill set? And that should kind of make its way down to the technician who possesses those skills. Absolutely.
Absolutely. And I think every practice, most practices that do dentistry probably see some of the most, perhaps not most critical, but most common patients with comorbidities. So definitely if there's a
Yeah.
VTS in the area that's serving that practice, it's definitely marketable. GP all the way to specialty, there's something to be offered for the quality of care of VTS and anesthesia and analgesia can provide that patient.
I just wanted to add one more thing. So you were talking earlier about like how you could prepare yourself for being successful at starting the VTS process. And I think one of the really important things is to sit down with your doctor or doctors, sit down with the office manager, tell them what your goals are and what's going to be required of you to achieve those goals so that everyone's on the same page. And that in turn, they can help you reach those goals. So it kind of, goes into the whole mentorship role, but having that discussion ahead of time and making sure that everyone knows, like, I need this skill set. I need someone to be able to help me master this. I need this type of caseload. I think that's extremely important.
I would also suggest I also need this amount of CE leading up to this event, and where can we meet in the middle and supporting me to get that continued education and then get in writing, okay, if I achieve this and am with this hospital, this brings these aspects to the table for the hospital's benefit. What is that going to look like for me on the other side as far as perhaps a pay raise?
Yes,
And then, of course, continuing education to maintain this. Does that look, how can your employer be supportive there too, right?
exactly.
Yeah.
Well, thank you both ladies. This was very, very had a large impact, I think, or will have a large impact on our audience for helping those achieve this credentialing process. Even if it's not in a VTS and anesthesia and analgesia, many principles apply across the board. Again, each academy has some slight variations and differences, but it's definitely important to support our peers towards this credential, and I appreciate everything you guys do to do that.
Yeah, thank you so much for having us.
Yes, thank you.